I am Stacy Chalmers. I'm Doctor of Audiology at Bloomington-Normal Audiology. I was born in Jupiter, Florida, but it was a little bit funny when I moved up here to tell, as a second grader, people where I was from Jupiter, and they would just all laugh and think I was joking, and I didn't really understand why they were confused by that. But I think my parents must pick interesting names, of places to live, because we went from Jupiter to Normal. Thought about teaching for a while, and in college I changed my mind a couple different times. Thought maybe physical therapy for a while, but I've learned then about audiology, and I wanted to do something helping people and in the medical field, but I don't handle blood very well, so this seemed like a good match, and I feel like I am, able to make a difference. I think it probably hit closest to home, though, with my oldest son. When he was a toddler, had a very severe ear infection, and things progressed very quickly, and his eardrum ended up rupturing, and so there was a lot of the emotion and difficulty dealing with all of that. Temporarily had a hearing loss from the issues he was having with his ears, but it was I think good for me to see it a little bit from the other side, and I really can sympathize with parents who are concerned about their children's hearing and speech development, and even just the health of their ears. My favorite part of being a doctor of audiology is hearing after they've had the treatment how much certain situations have improved for them, and how it has maybe made things easier for the patient or even their family members. One particular patient I can think of, when I first met her, was very anxious about even coming in for a test, and was pushed by family members, really, and you could tell was not real excited about being here. She was very guarded. She didn't open up very much, but she did agree to try hearing aids. And when she came back for her 2-week follow-up check, it was like she was a different person. She just opened up. She was very excited to be hearing. She wanted to tell me all of the different things that she had heard that she wasn't able to hear before, and her family was, almost in tears, just very appreciative that, she could be part of their family gatherings again. And for her, it was a very positive experience, and she was, I think, happily surprised at how much it changed things for her and how easy it was for her to get used to them. A lot of times people aren't really sure what's going to happen, and a hearing test is not anything painful, and not anything they can necessarily fail. So I think a lot of people get concerned right away, I'm going to have to wear a hearing aid, and sometimes they may just need their ear cleaned out. It can be as simple as that. If they are worried about, having to wear hearing aids, and maybe there's the negative stigma of aging, but we're seeing patients younger and younger, and there probably is a little bit of pride involved, but if that's the case, then we can reassure them that the hearing aids today are way above and beyond anything they can imagine as far as the technology, and being easy to wear, easy to adjust to, very discreet. Once they see what's available, and that we are really there to help them through the journey, we're not just trying to sell hearing aids, then a lot of times their demeanor changes, and they're much more relaxed and comfortable with the process.